It's like I'm having a really bad dream. I'm thinking maybe I do have something that is really serious. Maybe I do have a weird illness that I'm dying from.
Welcome to Diagnose This, where future doctors come to think differently so you don't miss what others did. In this series, you'll explore real patient cases that stumped even experienced physicians. As you watch, focus on how the patient is described. Remember, on your exams, you won't see the patient, you'll read the vignette. So train your mind to visualize, connect the dots, and think clinically. Grab your notes, sharpen your instincts, and let's see if you can diagnose this.
But what do you do when terrifying symptoms strike only once a year?
It was back in December of 2001. It was a Saturday afternoon around about 5, 6 o'clock at night, and I started to actually make dinner. And about 15, 20 minutes into the dinner, I had really bad stomach pains. I went upstairs to lay down in the bed, and I started to feel nauseous. I started feeling sweaty. I had a weird feeling. And the next day I remember I was on the bathroom floor.
I was downstairs watching TV, and I heard a bang. So I went upstairs, and he wasn't in the bed. I went into the bathroom, and he was laying on the bathroom floor. And I was like, what happened? And he was like, I wasn't feeling good. I thought maybe I was going to throw up. And he said, I think I passed out.
So she stayed with me for a while, and I was continually going back and forth to the bathroom, to the bed, to the bathroom. But I was vomiting a lot. I didn't know why I was vomiting, so the first thing I thought of was that I might have had food poisoning. Then after a while, I lay back in bed, and I told her I felt fine.
So I went back downstairs, continued to do some dishes, watch some TV.
About 30 minutes went by, and the same feeling started to happen again. So I got out of the bed, I opened the bedroom door, and I called my wife, Jordana.
And I heard a crash, and I thought he was dead. I thought he was dead because he was completely gray, no color in his face at all. His eyes were wide open, staring at the ceiling, and I just grabbed the phone and just dialed 911. When I was on the phone, he actually started to have a convulsion with his eyes roll back in his head. He makes some groaning noises, and it's like a grand mal seizure. His hands kind of, curl up, all of his muscles tense. All of the color went out of his face.
And all I remember her saying is that he's 37 years old, and I try to wake him up, and then I realize she's talking about me.
John Rogan suffered 2 seizures in one night. His wife, Jordana, rushed him to the emergency room. But while waiting to be seen by a doctor, John's body started to crash again.
They had him hooked up to some heart monitors, and he had another seizure. The nurse was freaking out because his heart stopped when he had the seizure. He flatlined on the monitor.
It was very frightening, the whole experience, but I kept saying to myself over and over again that it was something that I ate.
John was admitted to the hospital. They assigned us basically a neurologist because he'd never been to one before.
They kept me in intensive care for 3 days, and they ran a EEG test on me, an MRI, and an EKG, and they could not find out what was wrong. One of the neurologists that I had told me that it may have been a bad migraine.
What kind of a migraine would make your heart stop? That was the only diagnosis that we were given, and he pretty much was sent home with prescription strength Advil.
Despite the frightening symptoms, John was discharged from the hospital after 5 days. His doctors didn't think it was anything serious, and his family tried to put it behind them.
We had no idea what was going on, but we did feel that it was something he ate, that it was food poisoning or something like that.
Because we were kind of hoping that this was like an isolated incident, kind of a freak thing, and that hopefully it was never going to happen again.
John's life went back to normal for the next 11 months. But then, one night, he began to feel sick again.
About a year later, in November of 2002, he had another seizure.
I could feel my body going somewhere. I don't know how to describe it anywhere else other than I know that I'm gonna have a seizure. I know I'm gonna pass out.
I said, John, are we going to the hospital? And he was like, no, we're not going to the hospital. I'm not going back to the doctor.
John always, because it only happened once a year, he felt he was in control of it because it wasn't happening that often.
In my mind, I said to myself, it's food related. It's just like last time.
John tried to watch what he ate and hoped the problem would go away. 1 year later, he was feeling fine and the Rogans were expecting their first child. While Jordana was in the first stages of labor, John was excited, but anxious.
About 6 o'clock at night, I had asked if I can go get dinner before the kitchen closes. And the doctor said, oh, she's not going for another 6 hours or so. You have plenty of time. I'm only down there 5 minutes, and I hear them paging me. Mr. John Rogan, please come to maternity.
I found out that I was going to be having an emergency C-section, and John's down in the cafeteria.
So I try to get back to the room, and the elevators are like extremely slow. So then I said, all right, let me take the stairs. I go running up the stairs, but they lock it from the inside. So now I can't get into maternity. To me, this feels like an hour.
And he starts to freak out. So by the time he got upstairs, he was sweating bullets.
I started to feel sick. I started to feel nauseous, and I'm like, oh my God, I don't want to have a seizure here. And even the doctors noticed, John, are you okay? John, you don't look good. And now my poor wife's ready to give birth, and she's asking me, am I going to be all right?
That episode, and the birth of their son Patrick, made the Rogans reevaluate their situation.
It really made us, think, well, gee, this isn't just affecting us anymore. This is also affecting Patrick. And we need to make sure that we're both healthy so we can be there for him.
That's when I said, I'm ready to go to the doctor.
Almost 3 years after his first seizure, John went to see a new neurologist, Dr. Eric Engelstein.
Right from the first, 30 seconds that I saw him, I just saw a big difference.
Dr. Engelstein made us feel like he was going to do everything he could to try to figure out what was going on.
It's not infrequent to see someone with symptoms like John had. Anytime you hear someone losing consciousness and shaking, certainly a seizure comes to mind.
I went for an MRI, I went for the EEG again, I went for an EKG.
Well, the tests were normal. The MRI was normal, as is not unusual in someone who really has seizures. There just wasn't any obvious cause in his case.
Dr. Engelstein had told us that they're actually called idiopathic seizures, and you don't really know why you have them.
Dr. Engelstein prescribed a powerful anti-seizure medication, but John didn't like it.
Myself and the medication, just never agreed.
I noticed a change in his personality.
I couldn't think. I was sending emails out to the wrong people. I couldn't concentrate. I would start a sentence and not finish the sentence.
John had expressed some frustration with the first drug I gave him, and I switched him to something else.
He did a little bit better on that one. They had to change his dosage a couple of times, but he still had times where he was just tired. He felt wiped out.
Like, for instance, at his 40th birthday party, he was so out of it. He just was not himself at all. He was like a stranger, in a sense.
It was terrible that I even said, I think I'd rather be off the medication and take a chance of having a seizure than be on this the rest of my life.
John stayed on the medication and remained seizure-free for almost 5 months, when one day, the crippling feeling came back.
And so now here I am having a seizure while I'm on seizure medication.
So I thought, okay, well, now we're back to square one.
John Rogan thought he'd finally found the right medication to stop his unexplainable episodes, until another seizure stopped him in his tracks.
When John told me that he had another episode now, and this was on medication, on seizure medication, this was disturbing.
One thing that I had noticed is that when he has the seizures, all the blood drains out of his face. He gets pale as a ghost, gray.
And when you hear that someone looked pale or gray or blue, it makes you think, well, maybe there's a circulation problem. I had a question if maybe these are really seizures.
And Dr. Engelstein pretty much says, well, you know what? I don't think it's anything neurological, and I don't think there's anything else that I can do.
Dr. Engelstein referred John to a seizure specialist at NYU Medical Center, Dr. Orrin Davinsky.
John's case, there were several red flags. The biggest one was that his episodes would occur out of sleep, they were associated with nausea, and there was a clear relationship between him getting up out of bed, being nauseous, followed by a loss of consciousness.
Dr. Davinsky told John he wanted to keep him in the hospital for 3 days of testing and observation.
Now I really started to worry, is there something, do I have a brain tumor, or there's something that they didn't see when they did the MRIs, but maybe I do have a weird illness that, that I'm dying from.
On the second day, Dr. Davinsky scheduled a tilt test.
and I didn't know exactly what a tilt test was. If I had to describe it, it would be if I was like laying flat on like a stretcher, and then they would bring the stretcher up about at an 80-degree angle. And I feel like I'm almost standing up about a foot off the floor. I'm talking to the doctor and the nurse. All of a sudden, I said I'm starting to feel a little nauseous. And that was the last thing I remembered. The next thing I know, I wake up and I had a seizure.
And when he had the seizure, he freaked out all the doctors and the nurses that were in the room because his heart stopped, just like it had when they had him hooked up to the monitors in the emergency room the first time.
I've sent hundreds of patients for this test, and I've had scores of these tests be abnormal. I've never had any patient who's had their heart stop during this test.
They had told me that that the whole seizures is related to my heart.
John had a cardiac arrhythmia, a potentially deadly disturbance in the regular rhythm of his heartbeat. Periodically, his heart rate would drop so low that it would actually stop beating. This caused reduced blood flow to the brain and episodes that resembled brain seizures.
What was happening was, the days I was having the seizures, my heart rate and my blood pressure would drop so low that it would pass out and cause me to have the seizure.
John was overwhelmed when the diagnosis was presented. I think an incredible sense that an answer had finally been obtained.
I was actually relieved. I was actually happy. I'm thinking,
John's
maybe I do
doctors were
have
also
something that
happy
is
to have diagnosed
really
a case of
serious.
cardiac
Maybe I do
arrhythmia
have
with
a
such strange
weird
symptoms.
illness
A true seizure
that I'm dying from.
occurs when there's an abnormal electrical discharge in the brain, resulting in the shaking or whatever the symptom happens to be. This kind of seizure that was occurring in John was not because of an abnormal electrical discharge, but just because there wasn't a blood supply momentarily to the brain. But the result looks the same.
Occasionally, in a case like John's, the symptoms really overlap dramatically. And it's extremely hard, even for a physician who would witness the episode, to separate them had they not known the context in which they occurred.
Dr. Davinsky recommended that John have a pacemaker installed to regulate his heartbeat.
When I was being prepped and going into surgery, all I thought about was my son. I thought about my wife, but it's like I just wanted to come out of this, and be okay, and I wanted, to see him again.
He looked immediately better, and I don't even know if it was so much from the pacemaker, but I think just that the weight was kind of lifted off his shoulders.
I feel 100% better than I did. I'm not on any medication. I have a lot more energy than I used to have.
He knows that he's going to be there to watch Patrick grow up.
All right. How did you do? Drop a comment below and let us know. At what point did you first suspect the diagnosis? What were the key clues that tipped you off? If you didn't get it, don't worry. Even experienced physicians have missed these rare or tricky cases. Although they missed it, you won't. This is where future doctors come to think differently. If you need help to build strong, personalized systems for USMLE success, check out USMLE StepMate. We've got the structure, support, and strategy you need to turn clinical clues into exam confidence. Like and be sure to subscribe if you'd like more content like this.